Today I will be talking about histoplasmosis and coccidioidomycosis. Pathogen description. Histoplasmosis is a fungal infection of the respiratory system, histoplasmosis symptoms, and causes 2022. The typical causative agent of histoplasmosis is Histoplasma capsulatum, histoplasmosis symptoms, and causes 2022. Histoplasmosis capsulatum is a thermally dimorphic fungus, meaning it can grow into two different forms, mold stage and yeast stage. Histoplasmosis capsulatum is a species in the yeast stage as a small, uniform oval, narrow-budding yeast that is 1 to 4 in diameter, having an achromatic refractile capsule, enclosing a polymorphous chromatin nucleus, basophilic cytoplasm, and achromatic gaps, Darling 1909. During the mold stage, histoplasmosis capsulatum is characterized by septate walls. The hyphae have a smooth, thin wall, and normally 2.5 in diameter, and have a smooth, thin wall. The mold stage produces conidia released into the environment Gimmeries and Nossiter 2011. Histoplasmosis spreads by inhaling contaminated dust or soil particles containing the fungus's spores or contacting contaminated soil or water during demolition or cleanup projects. Histoplasmosis symptoms and causes 2022. Coccidioidomycosis is a fungal disease caused by coccidioid species that primarily affects the respiratory system and fever, but can spread to other organs. Tegeta garbe and Hoyer 2023. The typical causative agent of coccidioidomycosis is Coccidioides immitis, Tegeta garbe and Hoyer 2023. Coccidioides immitis is a dimorphic fungus with differentiable morphology in its parasitic and mycelial forms. It is a mold that grows in the desert soil. Barrel-shaped arthoconidia separate from the hyphae and become airborne when the cells degrade. Arthoconidia are the proper size to enter the terminal bronchiole during inhalation, measuring 2 and 5 microns. After entering the lung, arthoconidia remodel to become spherules, which are round instead of rectangular. Shedding of the arthoconidia's outer coat aids in this transition. Tegeta garbe and Hoyer 2023. The disease that causes coccidioidomycosis to spread is usually by inhaling airborne spores of Coccidioides immitis. The infection can also spread with contaminated rocks, dirt, or debris. For instance, construction, mining, or gardening workers who handle dirt or rocks harboring Coccidioides immitis may be susceptible to infection. Thomson Roman 320. Signs and symptoms of the infections. The signs and symptoms of histoplasmosis can be severe and life-threatening infections. Histoplasmosis symptoms and causes 2022. These signs and symptoms usually appear 3 to 17 days after exposure, including a fever, chills, headache, muscle aches, dry cough, chest pain, and tiredness. Histoplasmosis symptoms and causes 2022. Individuals affected by histoplasmosis may also experience joint pain and a rash. Those with pre-existing lung conditions, such as emphysema, may develop chronic histoplasmosis. Histoplasmosis symptoms and causes 2022. The chronic form of the disease can manifest with symptoms including unexplained weight loss and persistent bloody cough, which can sometimes be mistaken for tuberculosis. Histoplasmosis symptoms and causes 2022. Histoplasmosis if untreated. Disseminated histoplasmosis, a severe form of the fungal infection, primarily affects infants and individuals with compromised immune systems. It can spread to various body parts, including the mouth, liver, central nervous system, skin, and adrenal glands. Without treatment, disseminated histoplasmosis is almost always fatal. Histoplasmosis symptoms and causes 2022. Coccidioidomycosis signs and symptoms. The initial stage of coccidioidomycosis, also known as valley fever, often begins with mild symptoms that may not even be noticeable within 1 to 3 weeks after exposure. Symptoms may arise which are typically similar to those of these can range from minor to severe and may include fever, cough, tiredness, shortness of breath, headache, chills, night sweats, joint pain, and muscle soreness. Valley fever symptoms and causes 2023. In some cases, a red rash may appear on the skin if symptoms are not present or if the infection is asymptomatic. It may only be discovered later through positive tests or blood tests or routine chest x-rays that reveal small nodules in the lungs. While these nodules usually do not cause problems, they can be misdiagnosed as cancer due to their appearance on x-rays. Valley fever symptoms and causes 2023. Flu. Valley fever symptoms and causes 2023. Coccidioidomycosis if untreated. In rare instances, the coccidiosis fungus can spread to other parts of the body, including in the brain. If left untreated, this can lead to severe and potentially life-threatening complications, including meningitis and brain abscess. It's crucial to seek medical attention promptly if symptoms persist or worsen, as prompt treatment can help prevent serious consequences. Valley fever, coccidioidomycosis 2022. Histoplasmosis treatment and prevention. Treatment for histoplasmosis is typically reserved for patients with severe infections, including those with acute pulmonary disease, chronic lung infection, mesangial granula causing obstruction or disseminated disease. The primary treatment options include amorphatin B, its lipid formulations, and oral antifungal agents such as ketoconazole, iraconazole, and fluconazole. A new antifungal, triconazole, has shown promise in animal studies and may become a future treatment option. In general, hospitalization is recommended for patients with extensive disease. For AB or lipid formulation is typically used as initial treatment. Iraconazole may be used for mild cases or to complete treatment used as an initial response to AB. However, the role of intravenous iraconazole in severe histoplasmosis remains uncertain due to a lack of comparative studies with A and B. For individuals with a healthy immune system and no underlying conditions, histoplasmosis can resolve on its own without treatment. However, if left untreated, the infection could potentially spread to other parts of the body, particularly individuals with weakened immune systems and those with underlying lung disease. Histoplasmosis can cause significant lung damage if not treated promptly. Coccidioidomycosis treatment prevention. For most people with coccidioidomycosis, no treatment is necessary, but doctors closely monitor the condition if symptoms persist, worsen, or are severe. Antifungal medication may be prescribed. Fluconazole and itraconazole are commonly used to treat mild to moderate cases, while more serious infections may require intravenous antifungal medications such as amphotericin B. 3 newer medications, voriconazole, posaconazole, and isobutanol. Sulfate may also be used for severe cases. Antifungal medications can have side effects including nausea, vomiting, stomach pain, and diarrhea, which can usually resolve once the medication is stopped. Fluconazole may also cause hair loss, dry skin, dry mouth, and chappedness. It's essential to discuss the potential risks and benefits of treatment with a doctor to determine the best course of action. In the Southwest United States, Mexico, Central America, and South America, it is crucial to limit exposure to dust to prevent infections. Histoplasmosis preventive measures. Preventing exposure to the histoplasmosis fungus can be challenging, particularly in areas where the disease is prevalent. However, by taking certain precautions, individuals can significantly reduce their risk of infection. First and foremost, it is essential to avoid activities and projects that may expose you to the fungus, such as cave exploration and certain hobbies, like raising birds, like pigeons or chickens. Additionally, before digging or working in areas that may harbor the fungus, it is recommended to thoroughly soak the surface with water to prevent spores from being released into the air. This practice can also be applied to areas like chicken coops and barns before cleaning them, significantly reducing infection risk. Furthermore, wearing a respirator mask can provide an extra layer of protection, and it is recommended to consult with the National Institute for Occupational Safety and Health to determine the most suitable mask for your specific level of exposure. There isn't a licensed vaccine available to treat histoplasmosis yet. Coccidioidomycosis preventive measures. While it is challenging to completely avoid exposure to Coccidioidomycosis and Coccidioidomycosis fungal spores, there are steps you can take to reduce your risk of contracting it by taking precautions when in areas with dusty conditions. By wearing an N95 respirator mask to filter out fungal spores. Stay indoors during dust storms and keep windows closed. Avoid activities that store up dirt and dust, such as gardening or digging. Use air filter indoors to minimize airborne spores, and additionally prevent skin infections by thoroughly cleaning cuts and scrapes with soap and water. Epidemiology of the infections. Histoplasmosis common at times. Histoplasmosis in 2019 had a total of 1,124 confirmed and probable cases that were reported. Illinois accounted for the highest proportion of cases with 26% of the total reported cases. The incidence of histoplasmosis was relatively evenly distributed across the racial and ethnic groups, with a weight from 0.8 to 1.3 per 100,000 people. More than half of patients with histoplasmosis required hospitalization, highlighting the severity of the disease. The mortality rate was also significant, with 5% of patients succumbing to the infection. Histoplasmosis was a major public health concern in the early 20th century, particularly among children and adults with compromised immune systems before the widespread use of antibiotics and improved living conditions. Mortality rates were reportedly much higher, often exceeding 20%. Studies have shown that the prevalence of histoplasmosis in Central and South America can be high as 30% or more. However, there is a notable geographic variation in the seroplasm prevalence of histoplasmosis, with rates ranging from 0.1% in Chile to 90% in certain areas of Brazil. For example, in Peru, the seroprevalence is around 20%, while in Argentina, it is estimated to be between 35 to 40%. This highlights the importance of considering regional differences when assessing the burden of histoplasmosis in these regions. Histoplasmosis common in regions. Histoplasmosis is a widely disturbed fungus that thrives in specific regions around the world, often found in river valleys where it has become endemic. In the United States, the Ohio and Mississippi River valleys, as well as the southeastern states, are particularly prone to histoplasma outbreaks. As a soil-based fungus, histoplasmosis is typically harmless until its candia are disturbed and become airborne, allowing people to inhale them and contract the disease. Between 1938 and 2013, a total of 105 histoplasmosis outbreaks were reported, involving 2,850 cases across 26 states and the territory of Puerto Rico. The majority of these outbreaks occurred in settings where chicken coops or buildings undergoing renovation or demolition were present. And in many cases, birds, bats, or their droppings were found to be the source of the exposure. Workplace settings were also a common site for outbreaks, with 41% of incidents linked to activities that disturb birds or bat habitats. These recurrent outbreaks highlight the importance of increasing awareness about histoplasmosis, particularly in work-related settings where there is a risk of exposure to contaminated bird or bat droppings. Histoplasmosis outbreaks. In November to December 2001, a histoplasmosis outbreak occurred at an Indiana high school, affecting 682 students and staff. A cohort study was conducted to identify the risk factors for the outbreak, which revealed that 77% of those affected showed serological evidence of recent Histoplasma capsulitum infection, with 688% of them developing symptoms and consistent with acute pulmonary histoplasmosis. The investigation found that rudolini soil in a courtyard used as a bird roosting site in November 12, 2001, triggered the outbreak, with students and those in classrooms near the courtyard being more likely to contract the disease. The fungus was also isolated from environmental samples, finding soil and HVAC system dust. The largest outbreak of histoplasmosis among adolescents to date was caused by soil disrupting activities within the school courtyard, highlighting the need for increased awareness and education about the disease in endemic areas to prevent future outbreaks, as well as improved diagnosis and treatment by healthcare providers. Coccidioidomycosis, common at times. Coccidioidomycosis affects approximately 110,000 individuals annually in the United States, with the majority of cases occurring in southwestern states, particularly Arizona, California, New Mexico, and Texas. The highest incidence rates are typically found in areas characterized by temperatures, low humidity, and poor soil quality. In 2022, the Centers for Disease Control and Prevention reported 17,612 cases of coccidioidomycosis were reported to the National Notifiable Disease Surveillance System. The disease has been present in the southwestern United States for thousands of years, with evidence of ancient human exposure dating back to the 14th century. Before the 20th century, there were few recorded cases due to limited diagnosis capabilities and underreporting. The overall prevalence of coccidioidomycosis is estimated to be around 2 to 3% among people living in endemic areas, with incidence rates varies widely depending on location, with some areas reporting up to 40 cases per 100,000 people per year. Coccidioidomycosis common in regions. While coccidioidomycosis is typically associated with the southwestern United States, isolated cases have been reported outside endemic areas. Numerous scattered cases have been documented in various parts of the country, including Ohio, New York, Illinois, and Louisiana. For instance, a hospital in Ohio reported 23 cases over 18 years from 1980 to 1998. Similarly, an Alice of New York State Hospital discharge records identified 161 cases between 1992 and 1997. Additionally, individual cases have been documented in Chicago and New Orleans, often involving musculoskeletal symptoms. These isolated cases have highlighted the potential for coccidioidomycosis to occur outside its typical geographic range, emphasizing the importance of considering this diagnosis in patients with compatible symptoms even in non-endemic areas. Coccidioidomycosis primarily affects individuals over 60 years of age in California and Arizona, where the majority of cases occur. Coccidioidomycosis outbreaks. Coccidioidomycosis has also been reported in individuals who have traveled to areas where the fungus is endemic, including international visitors. Notably, an outbreak occurred after a model airplane flying event in Kern County, California in 2001, which attracted over 300 people from more than 30 countries. This event highlights the potential for international transmission and spread of the fungus, even among individuals who may not be native to the region. The first recorded outbreak occurred in 1896 in San Juan Valley, California, where it was referred to as valley fever during World War II. A large outbreak occurred among soldiers stationed in the southwestern United States, leading to increased awareness and research for the disease. Histoplasmosis can lead to the development of chronic pulmonary disease, a persistent condition marked by recurring lung infections and the formation of fibrinotic lesions, which can cause permanent scarring and damage to the lungs. Coccidioidomycosis is a relatively uncommon infection in Ohio, but is more frequently found among travelers who visit the southwestern United States, Mexico, Central America, and South America. And facts and stats about valley fever 2024.